we have to be aware of the fact that it's our collective responsibility to not allow this virus to spread. Hi, I'm Dr. Bill Kefalas. I'm the Director of Health and Wellbeing at the University of New South Wales and Director of the UNSW Health Service. The symptoms of COVID-19 are fever or symptoms of a fever, which are night sweats, chills, an acute respiratory illness, which is a sore throat, a cough, trouble breathing, a loss of taste or a loss of sense of smell. So they're the main symptoms. The other symptoms that are reasonably common as well are fatigue, joint pain, muscle pain, nausea, vomiting, diarrhea, loss of appetite. With any of those symptoms, then yes, you should get tested. So the people most at risk of more severe COVID-19 infection are those vulnerable groups who have a chronic illness, especially illnesses that affect your immune system, who might be on medication that suppresses your immune system. We have to be aware of the fact that it's our collective responsibility to not allow this virus to spread. So the COVID-19 test is free for anyone with health insurance, which includes all students and staff at UNSW. It's a very easy test to have. So they swab the throat first, and then they insert the swab into one side of your nose, turn it around for a little while, and then insert it to the other side of your nose and do the same thing. And then that swab is put into a little container and sent away to the laboratory to get tested. Many people are worried about catching the virus when they go to a testing location, so it's really important to understand that they enforce mask use and they also enforce quite strictly physical distancing, so there's no real concern about catching the virus under those circumstances. So initially, if you test negative for an illness and the illness persists and you remain unwell, it is important to go back and get another test. People are more infectious at sometimes rather than others. And sometimes if you test very early in the illness, you might miss the virus or the test quality may not be as good as it could have been, and so you get like what we call a false negative. So therefore, a few days later, if you're still very unwell, it is important to get retested.